Okay, welcome back to our Time to Thrive podcast. And today we have a super exciting guest. This topic that we're going to be having a great discussion about today is actually one that a lot of people don't know about and really should. So I'm happy that we have this guest today to really enlighten us all on how this can be affecting your health. So we have Susan Winograd with us. And she started her own company. She's a kick-ass woman. She's a businesswoman, an entrepreneur, and she is bringing so much light to this world, especially in regards to pelvic floor therapy. So we're going to talk about what that is. But she started Pelvicore, and she's based in Boca Raton, Florida. But she also works with wellness and health and how all of those things are connected to your pelvic floor as well. So welcome, Susan. We're so excited to have you. And I'd love for you to just start with, your story. What got you into this? What got you excited about becoming a pelvic floor therapist?
Thank you so much, Krista. I love what you guys are doing. And one of my favorite things to do is to talk about pelvic health and wellness and bring the conversation to the table and bring awareness to it. I'm the founder of Pelvicore Rehab and Wellness. I've been a physical therapist for about 30 years now. And before I had Pelvicore Rehab and Wellness, I had another company and I was doing concierge outpatient physical therapy in people's homes. And I really, really enjoyed it. And over the years, what I had started finding was that I was helping people recover from falls, and their physicians assumed that they were falling because of balance issues. And sometimes we have conversations with people, Krista, that their physicians don't have with them. And we have the privilege of really getting to know people. And what I was learning was that they were falling because they were running to the bathroom and they couldn't make it in time. So they were falling. And so I became very interested in pelvic health and wellness, and I started doing bowel and bladder retraining in that business and really changing people's lives, just helping people regain that control of their continence is life-changing. And then I don't know if you believe in divine intervention, but around the same time, a physician that I collaborate with called me and said, Susan, I've got all of these pelvic floor patients. I don't have no idea what to do with them. Will you learn how to treat them? And he specialized in prostate cancer. He actually sent me to Minnesota to my first male pelvic health course. And all I could say, Krista, was that they gave me the Kool-Aid and I drank it. I realized how fascinating pelvic health was, how intricate it was, how whole body it was, and how we can really change people's lives by optimizing their pelvic health. And I decided to really pivot. I closed my other company and launched Pelvicore Rehab and Wellness, and I never looked back.
So amazing. It's such an incredible journey and so needed. So for people who just have no idea what we're talking about, can you just explain what is the pelvic floor and why would you need to work on it?
Yeah, so I think there's two interesting things about the pelvic floor. One is that it's just anatomically, it's a group of muscles that lay at the base of the pelvis, from the pubic bone all the way to the tailbone, and from one side of the hip to the other. And there are 3 layers of pelvic floor muscles. Each layer has 3 muscles in it, and right and left. So already you're starting to get the picture that this is a lot more than just doing Kegels, right? And they're responsible for a really critical functions in our body: bowel, bladder, and sexual dysfunction. And in order to have good digestive health, you also need to have good pelvic health. So when we think about who needs pelvic health, we're going to think about anybody who needs good bowel, bladder, sexual, and digestive function, right? So everybody, that's the bottom line. Everybody needs to have good pelvic health. The other thing that's fascinating is people don't realize that the pelvic floor is part of your deep core system. It's what supports us during life. It's what keeps us upright. It works synergistically with your abdominal muscles and synergistically with your muscles for breathing. So we're often very preoccupied with a good core or good core strength, and you simply cannot have that without good pelvic health. Did that answer your question?
Totally. Yeah. I think so many people just are disconnected from that area, right? In all ways. And, there can be emotions held there too that sometimes I'm sure you're working on as well. Is that right?
Absolutely. So, with gut health, we always say the gut is the second brain, right? This is your first brain and the gut is the second brain. With pelvic health, the pelvis is the second heart. So this is our first heart and the pelvis is our second heart. So yes, we hold memories, we store emotions there. Subconsciously, and very often when we do work with people and peel back those layers, they do have what's called a somato-emotional release, which means they release any trauma or emotions that may be stored there that may have been limiting their progress toward healing unbeknownst to them. So absolutely, it is a really intimate, special part of our body.
Exactly. Intimate is the right word. And I think a lot of people are afraid to seek out pelvic floor therapy because they don't really know what's involved or how an assessment or a treatment is done. So can you speak to that a little bit?
So the first thing that I think everybody should know about a pelvic health exam is that number one, it's not like a gynecological exam. You're in control. We really work very hard to hear people's story and communicate with them and get to know them as individuals. And your pelvic health provider should also really be coming from the perspective that your pelvic health is a whole body approach. So when we have someone, we do a regular orthopedic assessment. We want to look at your posture. We want to look at your range of motion and your strength. We want to understand your pain points and what your concerns and your goals are and how your breathing is. And then we do with the person's permission, and it's very gentle and we guide them through it step by step, but we do a pelvic floor exam, which could be vaginal or rectal, and we assess the strength, the tone, and the endurance of all three layers of the pelvic floor muscles, left and right. Now you can, if that doesn't feel right to you, you should still go to a pelvic floor practitioner, because although we do glean so much information from that pelvic floor assessment, there is so much that we can glean from an external inspection and just having you recruit. So if people have a concern that needs to be addressed, don't be afraid to come to a pelvic floor therapist. We're here to meet you where you're at. So it's super gentle. It should be very comprehensive, and it should be a full body assessment from the top of your head to the bottom of your toes.
Yeah, all your muscles in there are connected to other systems in your body, and so super important that everything is looked at and assessed. And then from there, what would be some things that you might do as a treatment? I know people think like, oh, it's just Kegels, right? That's the only thing that you do for pelvic floor.
Right. So that's a great question. So just in speaking to that, there are many people who need Kegels, and that's okay. But they actually, this is going a couple of years back, they did a study, and I think they looked at how 480 women did Kegels, and they found that 80% were doing them wrong. Right? Because we have three layers of pelvic floor muscles, and all these women were opening and closing and opening and closing, but they weren't working through that third layer and closing and lifting. So for people that need Kegels, we want to make sure that they're connected to that part of the body, that they are doing it the right way, that they're recruiting both sides and through all layers. So we want to make sure that, and that their pelvic floor is working in coordination with the rest of their body. The other thing I think is really important for people to know is that Kegels can actually make you feel worse if it's not what you need, right? So a lot of people think if you're leaking, if you have constipation, or if you have any bowel or bladder dysfunction, just start doing Kegels. But if your pelvic floor muscle is holding too much tension, then Kegels are going to make those symptoms worse because we need to release that tension. And that could be a tricky thing for people to navigate on their own, because the symptoms of an overactive pelvic floor and an underactive pelvic floor could be very similar. So you do need a trained professional to help you do the right exercise. The other thing that a home exercise program looks like, and of course, everything is individualized, but I'm going to speak to some very common components of what a home exercise program may look like, is breath work. The entire deep core system, the pelvic floor, is led by the breath. So we use different kinds of breath strategies to either engage the pelvic floor or relax the pelvic floor or connect to the pelvic floor. So to me, breathing is fundamental and foundational, right? What I always say is that there are different breaths for different purposes. So people come to me and they're like, how should I breathe? What's the right way to breathe? And I say, for what purpose? So we don't want people to think that they're locked into one way of breathing, but we have to figure out what breath practice you need. And the other foundation and fundamental thing I would say is alignment, because your diaphragm, your muscle for breathing, and your pelvic floor work synergistically together by a process that's led by the breath. So if we are not in optimal alignment, though, our core components won't be able to communicate as well. And I've had many clients who have come to us with pelvic floor issues, and we work on their alignment, and it's life-changing for them. And alignment, one thing I do want to say is alignment looks different for every single person. So I grew up, my mom always said, shoulders back, head up. And that's not how we view alignment. Alignment is finding that space for each unique individual where their core components are aligned and working optimally and efficiently.
Got it.
So those are, and then, we do give a lot of regular stretching and strengthening and core exercises that's individualized for that person, but you'd be surprised about how comprehensive and whole body a pelvic floor home exercise program would look like.
I know because I actually went through pelvic floor therapy myself after having my first child, which
For
for all of
you.
you listeners, in the US, that's not really something that a lot of people do. In other countries, though, that's part of the regular routine. After you have a child, you should be going through pelvic floor therapy because just like any big trauma or any big surgery, you need to rehab those muscles that have been strained and stretched and all sorts of discombobulation, right? And so going through that pelvic floor therapy, you would be surprised how much intention it takes, focusing on your breath, engaging certain muscles, things that you thought were maybe simple in the past or you didn't pay attention to in your exercise actually can be pretty complex if you really understand what you should be doing and engaging when you are doing those exercises. So it's really, really helpful to have someone guide you through that to make sure you're doing it correctly and don't cause problems for yourself down the line.
Yeah,
Is there
absolutely.
anything that you see as kind of a result of people not addressing their pelvic floor when they should have?
Yeah, so a couple of things. I'm going to I love what you said, Krista. I had a sweet client who ended up giving birth here from Spain, and she called for an appointment. And I said, well, what brings you here? And she goes, what do you mean? I had a baby. She said, everybody in Spain gets pelvic floor therapy after they have a baby. So we're a little late to the table, but I do believe we're getting there. But I would take it even a step further and say, every pregnant woman should have at least a pelvic floor assessment during pregnancy. And I will tell you, if you learn, when you're pregnant, your center of mass, your center of gravity is constantly shifting and changing. And if you can learn how to move with that optimally and stay supported and stay connected to your belly that's going to be stretching and stay connected to your pelvic floor throughout the process, without exception, I've seen every mama who has pelvic floor therapy during pregnancy do better postpartum. The
Totally.
one thing that I do see, and I know that very often we don't really think down the line, right? But what I always think, and I've been a therapist for 30 years, in pelvic health alone for 10, is that I see a lot of issues coming up in perimenopause and menopause. And I know that if these mamas had pelvic floor therapy after birth, a lot of these issues could have been avoided. Also, a lot of moms, there's, thank God, or for Google, or maybe Google's, not the best thing, but a lot of women do have babies and, they go back to an online exercise routine, but really don't understand how their bodies have changed. And we have had moms that have done that and, started leaking when they weren't immediately postpartum, or maybe they went back too soon and developed a pelvic organ prolapse, or we don't want to catastrophize. We want people to go back to exercise in a safe and smart way. So, I see the full gamut, but what I would say is the most profound thing is think about your health down the line, and know that if you're proactive about it now, you will probably save yourself a lot of grief in the next season of life.
And I think that's important. We talk about this all the time, being proactive, not just reactive, right? In my story, I talked about, oh, I did pelvic floor after I had the child, but just like Susan mentioned, really starting before is the key, right? So that you can prevent those things and you're stronger as you go through the labor process, et cetera. And that's the same for anything, prolapse later in life, that can be prevented if you're proactive about it. So seeking out help before there's a problem too is super, super important.
Yeah, I had a sweet mama that just came to me. She wasn't even pregnant yet, but she was going into her fertility journal and she said, you know what, I just want to make sure everything's okay. Which I love. I'm like, oh my gosh, can I put you on a megaphone and have you, speak to every woman out there? And in doing her full body assessment, we learned that she had a paradoxical breathing pattern. And instead of her pelvic floor lengthening when she was inhaling, she was contracting and engaging and shortening. And she just was blown away. She said, I want to have a natural birth. How would I have gone into a natural birth not knowing or feeling what my pelvic floor is doing and actually doing the opposite of what I wanted it to do? Now, we know birth is a reflex and we know your body's going to do what it needs to do. But if we know how our body works and we can work with it, then it can be a completely different experience.
Yeah, so profound and good for her. More and more people are starting to learn that they need to be proactive. So I'm glad that people are catching on slowly but surely.
Yeah.
So for you, what would you say are some of your favorite things to work on in the pelvic floor? Obviously, there's so many things you can address, but if you had to just choose one, what would that be and why?
Your breath. I mean, there are so many. It's really, really hard to choose one. And I think that when we're looking at pelvic health, it's multifactorial, it's full body. But I'm going to say breath because I think breath has the opportunity to affect every system in your body. The breath is magical. It can modulate your nervous system. It can help with digestion and constipation. It can help with your bladder. It can help with the length and tone of your pelvic floor. So I'm obsessed with the breath. I think it's magical. So I'm going to say you're breathing.
Awesome. I love that because it's all holistic, right? It's all connected. So you can't just say, oh, I'm only going to strengthen this muscle or lengthen it without also working on the rest of your body, which includes other things as well, like nutrition. Are there certain things you recommend people do just, systematically to help with pelvic floor?
Yes, yes. Hydrate. So I always say hydrating is probably the easiest and one of the most effective ways to optimize the health of your pelvic floor, but also your body, your digestion. Every cell needs to be hydrated. So hydration. The other thing is food that you actually have to chew. So what I tell people is to eat colorful foods that grow from the ground that you have to chew, right? Um, and I just feel like we need to eat healthy. We need to hydrate, and obviously we want to eliminate toxins. So we want to decrease all those processed foods. People don't realize that there's a mechanical way to poop the right way. There's a mechanical way to pee the right way. So we want people to know all of that. But just in terms of nutrition, I would say hydration, fiber, and just getting, all the nutrients you need. Like, for example, magnesium is a really important part of pelvic health. 70% of the population is deficient in magnesium. So when we talk about pelvic health, we talk about the basics of nutrition, hydration, fiber, and just trying to get those sources of nutrition from things that grow from the ground.
Exactly. Yeah, really minimizing that inflammation and making sure you have enough hydration. Those are certainly key. And I know you
Right. And
mentioned, I
yeah,
know
of
you
course, from a
mentioned a couple
health
things.
perspective,
Go
yeah,
ahead.
go ahead. No, I was going to say, of course, from a pelvic health perspective, we will educate more specifically about nutrition for certain things. For example, if someone has urinary urgency or frequency, we may tell them to stay away from bladder irritants for a certain amount of time, like caffeine, alcohol, carbonation, acidic foods. So when we're speaking very broadly, we're talking about hydration and fiber. When we're speaking more specifically, of course, we have to look at what that unique person sitting in front of us is presenting with.
So you're saying that what you put in your mouth actually affects your organ systems. Hmm?
I am absolutely saying that. Absolutely.
I
I
love
will
it.
say that I think it affects every system in your body.
Yes, I agree. So you mentioned a couple things that I feel like a lot of people don't know about, they don't talk about, one of which I actually love to talk about, which is there is a certain way to help you have a more easeful bowel movement, right? There's ways you can learn to do that, and a lot of us aren't doing them. But another one that I think a lot of people don't talk about is just sexual health, right? Pain with intercourse, for example. Do these people have hope? Is there something they can do? Is it something they have to live with?
Yeah. So thank you so much for bringing that topic up, because I'm passionate about that topic, as you know. Just because something is common does not make it normal. Sex is a really, really important part of life. It's an important part of intimacy in a relationship, and it should not be painful at all. So if sex is painful, I would say go get the help you need as soon as possible, because I would say it's one of the things that we treat that has complete resolution. A lot of it should have complete resolution in a relatively short period of time, depending on how long they've been living with it, or how complex it is. But a lot of women think that they should suffer through it because they don't realize that there's so much we can do about it. And why would you want to do something that hurts, right? Why would you want to do something that's not enjoyable? And then that causes more stress and more pain. If anybody tells you just relax or have a glass of wine, I give you permission to throw that glass of wine in their face, because if we could just relax, we all would, right? We need to retrain those muscles to be able to know that it's safe and it's okay, and resolve whatever issues or musculoskeletal component of that is making it painful. But there absolutely is hope. Our bodies are meant to be, well-oiled machines that are working for us, not against us. We just have to teach it the right way. And any good pelvic health therapist should be able to help you overcome pain with intercourse.
Isn't that amazing? I think so many people just push through a lot of these things because we don't talk about them. We don't know that there are answers. And so seeking out someone like Susan can be really an enlightening experience and beneficial for all of your health. But I just wanted everyone to know that there is hope. And like she said, relatively quickly, which is amazing. So great to hear. The other thing I wanted to touch on is men's health, because I feel like a lot of people think pelvic floor is just for women. And I know you mentioned prostate earlier, but other things that men come in for or should come in for?
So we love, one of the things that I'm proudest about in Pelvicore Rehab and Wellness is that we help men too. There's a lot of women's health practices out there. There are not as many men's health practices. So I'm super blessed that we do help men. The interesting thing is that men have almost identical anatomy of the pelvic floor, with the exception of, the external genitalia, and we have a uterus, they have a prostate. But men come in with very similar issues of bowel, bladder, and sexual dysfunction. And there is so much help out there for them. I think in a way, sometimes men may struggle with it for longer because they don't realize that they can have the same issues as women, or their healthcare providers are not as quick to refer them to a pelvic floor physical therapist. So for example, the default with a lot of men is to tell them they have prostatitis, right? So our poor, sweet gentlemen that come to us that have pelvic floor pain that may present in various scenarios, many of them have been to 7 to 10 doctors. They've been on multiple rounds of antibiotics, and they are truly at their wits' end. And then they come to us and we're like, your pelvic floor is playing a huge role in your health concern. And the first question they inevitably ask is, why didn't anybody tell me about this sooner? So there is so much that we can do to help men. And I encourage every healthcare provider, every man listening to this, if you're struggling with any bowel, bladder, or sexual dysfunction, seek the help of a pelvic floor therapist.
Is it easy to find pelvic floor therapists? How can someone search that out if they need to?
That's a great question. I think that it is easier than people think. I think you have to, first is awareness to know to search for it. That's the first thing. You can go to the Herman and Wallace website, which is where I've gotten a lot of my training, and they have a directory where you can look up practitioners in your area. There's another platform called Global Pelvic Physio Health, which is an organization where, again, you can go on their website and look for a directory. But you also have to do your own research, because truthfully, not every pelvic health provider is created alike, just like not every healthcare, any practitioner is created alike. So you have to make sure that they're using a whole body approach, that they're really listening to your story and putting whole pieces of the puzzle together. I've had pelvic patients where I end up treating their foot or their knee because we want to find out what the root cause of their pain is. What's driving their pain? Because we know that the origin of pain could be at a distant site from where the person's feeling it. So you truly, truly want to do your research and make sure that you're not only finding a pelvic health provider, but you're finding one that's going to give you the holistic treatment that you need and deserve.
Yeah, I think, like you said, with all providers, whether it's a therapist or an acupuncturist, if you go to someone and you don't resonate, that does not mean it's not good for you, right? You just need to find someone who you connect with, who's more your speed and looking at it holistically. So don't give up if you've had that experience, because there are many different people out there.
It's a relationship. That's why we offer 15-minute free discovery calls, because we truly understand that it has to click. It has to connect for you. And if it doesn't, that's okay, because we truly want everybody to be connected with a provider that they feel comfortable with.
Exactly. So do people need a referral in order to seek out pelvic floor therapy?
No, they don't in the state. Well, we're in the state of Florida right now, so it's direct access. So I think that's a really important point. We don't need a referral after a certain period of time. We do need to get in touch with their doctor and let them know what the plan is. But we want to communicate and collaborate with their other healthcare providers. The first thing I tell people when they come through my door is, if there is any other healthcare provider that you're working with, we want to talk to them. We want to collaborate with them. So we don't need a referral, but we will communicate and collaborate with anybody else that you work with. But in the state of Florida, we do have direct access.
It's amazing. That's the way it should be. And collaboration behind your medical team is so important. A lot of times your team isn't talking to each other, right? And again, we're saying all of these things are connected. So super important, especially if you're seeing like a GI doctor, for example, and then you're getting treated with pelvic floor. Those people probably need to talk, right? Because they're working on similar things. So
We're
Susan, go
that
ahead.
we have that connection and collaboration with lots of physicians.
Yes, yes. So, what other symptoms that you haven't mentioned might people seek out a pelvic floor therapist for? Like maybe they have no idea that's where some issue is stemming from, like any symptoms you can name?
Yeah, so I would say a very common one is low back pain.
Mm,
Low back pain is, I forgot what the percentage is, but I think 80% of pelvic health symptoms can manifest as low back pain. I would say groin pain, bra line pain, even rib pain, bloating, right? Bloating distension can be a digestive issue. It can be a pelvic health issue. Knee pain, really it's so diverse. Pubic pain, abdominal pain, inability to get a deep breath. I know we're going up and down the kinetic chain here, but again, it's whole body. I want you all to remember that pelvic health works with your muscle for breathing. So as soon as you bring in air through your nose and your mouth, your pelvic floor is directly affected. But, and of course, what I always tell people to look for with pelvic health specifically are the 4 Ps: peeing, pain, poop, and pressure. Those are the symptoms you want to look out for specifically for pelvic health. And when we say pain, we mean that in a broader term: groin pain, pelvic pain, hip pain, low back pain, bra line pain, pubic bone pain. So those are the 4 Ps that you want to look out for.
I love that. That's an easy way to remember, because a lot of people are having those 4 Ps as we speak. So if that's you,
Yeah.
definitely start finding yourself a pelvic floor therapist. Okay, anything else, Susan, that we haven't talked about that you feel is important for our listeners to know about pelvic floor or wellness in general?
Yeah, I think the most important thing to know is that you should be proactive about your health. I think that, everybody needs to be concerned about their pelvic health, sometimes more so in certain seasons of your life than the other, but that everything is connected. So at Pelvicore Rehab, and wellness, we look at the whole body. So when you come to us with pelvic pain, we're going to ask you about depression, anxiety, stress, catastrophization, because your nervous system is intricately related to your pelvic health. And you're never going to get full musculoskeletal recovery if your nervous system's not balanced. So truly do your research and make sure that you're getting the help you need, number one, and that you are getting the full picture looked at, because you're like a puzzle and you need a provider who's going to look at all the pieces of the puzzle and put it together in a big, beautiful picture.
I love that analogy. Super important, especially because your pelvic floor is so much the connector of everything else that's going on. So really great information you've shared today, Susan, and I'm so glad our listeners have access to you. So if someone wants to reach out or learn more, where can they find you, follow you?
Yeah, so it's not that hard to find me, I don't think. You can go to pelvicorerehab.com. We're on Instagram at Pelvicore Rehab. We're on Facebook, Pelvicore Rehab and Wellness. Our website is pelvicorerehab.com. And we're out there. We have a YouTube channel called Pelvicore Plus that has a lot of great content on it. And if you have any questions, anybody's should feel free to reach out and call me and ask me any questions, because the most important thing is knowledge and education.
Awesome. And for everyone, you'll also be able to listen to this podcast fully on our YouTube channel, Live Wellness YouTube. And we'll have different reels for you on our Instagram and our Facebook, which is actually under my name, Dr. Krista Emery. So you can see these facts over and over again from Susan. But so glad that you were able to join us, Susan. And for our listeners, keep thriving, keep doing all of these holistic tips and tricks that we're bringing to you each week so that you can reach optimal health. This is just another avenue today that you can start to explore to get yourself to the best health possible. So we'll see you again next week. Thanks so much, Susan.
Thank you.